Good morning, everybody. It's a wonderful day, and it's a very wonderful day because Erlan is there with me today. I am so happy. I have missed Erlan for quite a while now, and I guess he saw the excitement when I saw him on Friday across the street. It's like, oh my goodness, yeah. But I'm so happy. Welcome back, Erlan. It's always nice having you. Um, so thank you, Rome, for setting me up this morning. Let me just say a happy good morning to all our listeners out there. Hotel Shokula, Miss Anne, OJ's, Odell's, those persons at the car park. What should I say? The bus terminal, the vendors, the bus drivers, persons at M&C. I'm always happy that you're listening on. Also, our persons from countries and persons listening online, thank you so very much. Or even persons looking at our YouTube videos after. I mean, some persons told me they really looked at it on YouTube. So again, thank you so very much for being there, listening on. So this morning, I want to speak a little bit about something that's going on in the air, and that is the flu. Many of our children has the flu, adults have the flu, and I think I'm getting the flu, but I think I'm strong enough. My body's kind of fighting it. And again, my dad had oranges, so I guess my body was kind of boosted up with some vitamin C, and I've been eating quite a bit of fruits lately. And then one of the things persons need to realize is that today, now, since the flu is going on, you need to take precautionary measures, especially wearing your mask. I mean, after COVID, a lot of people tend to, forget about the mask, but the mask is very important. And once you have the flu and you come and seek medical attention, wear your mask. When you're walking in town, wear your mask. That's an indication to tell people you have the flu, and not necessarily COVID, but you have the flu. So persons will take heed and, take all the necessary precautionary measures. And you're protecting the next person. Okay? So I have some friends of mine with the flu, and they've been saying that they have the body aches and pain, the fatigue, and it's not a nice feeling. Our children now cannot go to school because they have the flu, and especially our children with respiratory problems like asthma. Trust me. These are the things that we need to be mindful of. Especially parents, your child have the flu, keep your child home. Runny nose, keep your child home. You might be affecting someone else, and even the teachers end up getting the flu. So what sense does it make to send your child with the flu, the teacher get the flu, and there is nobody to teach the child, or the child cannot learn the lesson? Because, the substitute teacher will come, but so these are the things you have to take into consideration as a parent. So today I want to speak a little bit about the signs and symptoms of the flu and the cold and COVID. So some people, they tell me, Louisa, I don't think it's the flu I have. I think it's COVID. Some people saying, I think I have the cold. People speculate based on their symptoms. And they say, a friend of mine tell me, you can tell me what you want. That is COVID. That cannot be just the flu. So I want persons to be mindful. If you feel you're having signs and symptoms of COVID or the flu, where you don't eat, you feel a little dehydrated, come seek medical attention, because now is the time, so that the doctor can do the prescribed tests. They can do the rapid COVID test. They can do the various tests for you to find out what is actually happening to you. So before I go on, so influenza, the flu, and the common cold are both contagious respiratory illnesses that are caused by different viruses. So in reading today, I say, the common cold and the flu, I mean, they are caused by different viruses, but sometimes you get the same signs and symptoms, and very few things differentiate from the flu and the common cold. So the colds and the flu share many symptoms, so it can be difficult to tell the difference between them based on symptoms alone. Cold symptoms are usually milder than the flu, and special tests can tell if the person is sick with the flu. So that if you go to the doctor and you say, Doc, I want to know if it's the flu or the cold I have, then they can perform the relevant tests for you. Yes? So that is one of the things I want persons to be mindful of. So the signs and symptoms, the symptoms of the flu can include fever or feeling of feverish, chills, cough, sore throat, runny nose and stuffy nose, muscle and body aches. And that is what a lot of people have been complaining about. Yeah? Headaches, fatigue, that means tiredness. So a lot of people have been complaining about the body aches and pains, the fatigue, and so on. And the cold symptoms are usually milder. Yeah? Like they have runny and stuffy nose. And these are the things we have to be mindful of. So sometimes you feel, okay, I have the flu, I have the cold, but what do you really have? And that's one of the things we need to ask ourselves. So in a nutshell, you might have the flu, you might have the cold, the common cold, or you just might have COVID. And that is one of the things a lot of people fail to realize. So the flu, the cold, the common cold, and COVID share similar signs and symptoms. And one of the things about both COVID and the flu, influenza, and here the symptoms, the signs and symptoms. Fever or feeling feverish, we just heard that about the flu. Not everyone with flu will have fever. So you have the cough, you have the shortness of breath or difficulty breathing, you have fatigue, you have the sore throat, you have the runny nose or stuffy nose, you have the muscle pain and body aches, you have the headache, you have the vomiting, some persons get diarrhea. It's more frequent in children with flu, but can occur in any age with COVID-19. So you see the similarities. Change in loss of taste or smell, although it is more frequent with COVID-19. So who is to say you have the flu, or is to say you have COVID-19 unless you do the prescribed test? And that's where we need to understand what is really happening out there and why we need to take the necessary precautionary measures by ensuring that we wear our mask, we sanitize our hands, or we wash our hands properly. And let me tell you, one of the things is that many people don't walk without their hand sanitizers anymore. But some people have broken that habit. They stop it, and we need to bring that back. Always have your hand sanitizer hanging and sanitizing your hands when needs be. And these are the things you need to understand. Yeah? So, if you have any of these symptoms and you're feeling dehydrated, you're feeling weak, you're feeling sick, come in to seek medical attention. Bring your mask when you come and see the doctor, and tell the nurse or the doctor all the signs and symptoms that you've been having. Okay? So on the flip side, One of the things that we have been observing from last year to this year is that when students get the flu, the cold, or is it COVID? I'm not sure. The early childhood centers, as well as our schools, need to start taking the precautionary measures of ensuring that the cleaning and disinfectant regime or the monitoring patterns or the schedule needs to be maintained. So during COVID, in the morning they would wipe down. We need to continue that same thing. So many children, when they come to school, they get the flu, and that is where, the medium, that is where it all starts. And these are the things that we need to continue to do. And for the early childhood centers, we need to continue doing these things to stop the transmission. We need to do it. We need to start doing the deep cleaning. Because last year, many children had to stay home. And we know why. So this year, we need to stop it. We need to, and parents need to play their part by ensuring that they don't send their children to school during that time. Your child is sick, you see the signs and symptoms, you need to leave the children home. Don't drop the children by the gate and tell them run in. Parents do that all the time. Or just give them the medication just before or 30 minutes before so that they don't exhibit any signs and symptoms. And by the time they arrive at school, especially at our daycare centers and preschools, within 30 minutes in the classroom, their nose are running, they have a headache, they have fever. And the other thing is when the teachers or the administrators call on you to come to pick up the children, many parents don't come. They wait till the 3 o'clock. That defeats the purpose. Yes, because our early childhood centers, many of them don't have a sick bay. And if they do, think of how many children that might be in that sick bay at that particular time. So we're asking you to bear all of that in mind. So one of the things I really want to talk about today is the cleaning, the disinfecting, and the sanitizing of surfaces. How do we clean? How do we disinfect? And how do we sanitize? Especially for our early childhood centers. So cleaning is done with soap, water, and scrubbing. So you use the dishwashing liquid, you use the water, and you use a scrubbing brush or use the prescribed cloth to clean. And what does cleaning do? It removes germs, dirt, and impurities from surfaces. So just not water and your cloth and you clean. No, that's not cleaning. You need the soap. You need the active ingredient there. Cleaning alone can remove most types of harmful germs like viruses, bacteria, parasites, or fungi. So you can do that. I'm not saying you have to disinfect and sanitize every day, but you need to maintain a cleaning schedule and to ensure that it is being adhered to. So you have the soap, the water, and the cloth, and you clean away. Yeah? Now, disinfectant is done with a bleach solution or other chemical products. The chemical destroys the remaining germs on the surfaces after cleaning. Clean surfaces before you disinfect. Disinfect surfaces when someone is sick or at a high risk of getting sick. 2 students come in the class with the flu. You know you have to start cleaning and disinfecting. That is a must. And one of the best disinfectants is just bleach. Not scented bleach, just the normal bleach. And this is one of the things you need to understand. After you clean, then you disinfect. And sanitizing reduces the number of germs on surfaces to levels public health codes or regulations consider it safe. So these are the things you have to do. Ensure that you sanitize to bring everything to a safe level where the following day the children can come back to school. Yeah? Sanitizing is done with a weaker bleach solution or sanitizing sprays. Clean surfaces before you sanitize them. Sanitize surfaces that come in contact with children's mouths, such as infant feeding items and toys. So these are the things we have to bear in mind, especially for our early childhood centers. What you do impact our child's health quite a bit. I'm not saying that our early childhood centers don't clean, don't disinfect, don't sanitize. I'm saying both the centers and parents need to play their part when a child is sick. It doesn't make sense that the school clean, sanitize, and every day a parent send their child that is really, really sick with the cold or the flu. Yeah? So, when to clean? And you clean visibly dirt surfaces, including lunch tables, craft areas. You clean daily after a meal or activity. And that's one of the things that you need to do. So you take your cloth, you take your detergent, and you take your water, and you clean. Yeah? So some of the places that there are high-touch surfaces, such as the tabletops, the doorknobs and handles, the toys, are more likely to have germs on them. If the area is used often, you need to clean it more often or disinfect it in addition to cleaning. So the areas that the children, like the blocks that they use, the toys, you need to clean them and disinfect it because these are the things that they really use. So these are one of the things we want you to bear in mind. Yeah? So how to clean? How to clean, and in a while I'll tell you how many parts of bleach to how many parts of water to clean and sanitize. I mean, not clean, disinfect and sanitize, sorry. So, you have hard surfaces and you have soft surfaces. So, hard surfaces are certain toys, high chairs, trays, floors. And then you have your soft surfaces that are clothing, cloth toys, and rugs. So you have to understand how to clean these things. So some of them, you can clean it with cleaning products appropriate to use on these surfaces. Some of them, you have to actually wash them as a manufacturer's instructions. And for the carpets, the mats, and the rugs, you know you have to vacuum them and dispose of the dirt safely. Yeah? So these are the things you have to take into consideration. You have to ensure that's what you do. Okay? So how to clean? You prepare a solution of 1 tablespoon of unscented bleach per gallon of water in a clean basin. So 1 tablespoon of bleach per gallon of water in a clean basin. You have to put items completely underwater and make sure the solution touch all parts and soak it for at least 2 minutes. Remove with clean hands and tongs. Yes, so some persons will have to wear gloves. Do not rinse because germs could get back onto these items. Any remaining bleach will break down quickly as it dries and will not hurt children. So that's one of the things you have to remember. You have the blocks, you have the toys, you have the thing. You 1 tablespoon of bleach in 1 gallon of water, and then you immerse it completely in the solution. So everything, nothing must remain above water, everything has to be below water. Yeah? So these are the things you need to understand. What you should do and why you should do it. Because many times our children, every week, some parents leave their children home, and every week they come back. When they come back, they get the flu again. So you could well understand what a parent is going through. They are working individuals. They cannot afford to stay home. They're already paying the school fees or for the primary school and infant school. The high absenteeism means that they're missing out quite a bit in their lessons plan. And that's what parents need to be mindful of. So you need to understand all of these things. When your child has the flu or any other contagious condition, do not send the children to school. Wait until the okay is given, the child no longer exhibit the signs and symptoms to send the child to school. Yeah? So, for disinfecting, regularly disinfect some areas in early care and educational settings, such as bathrooms and diaper changing tables. So after you clean these areas, you still have to disinfect. Immediately clean surfaces and objects that are visibly soiled. If surfaces or objects are soiled with body fluids or blood, use gloves and other standard precautionary measures to avoid coming in contact with fluid. Remove the fluid and clean, and then clean and disinfect. So the child goes to the bathroom, he or she blows his nose. You could plainly see sometimes there is cold on the surface. You have to clean and disinfect. Yeah? All of these things you have to take into consideration. So before you use anything, you know you have to read the manufacturer's label, especially for the bleach. I said no scented bleach, is just plain bleach. And any disinfecting wipes or anything of this sort, you have to ensure that you use it according to the manufacturer's instructions. And you have to ensure that you wear your protective clothing, like your gloves and your goggles, when you are cleaning and disinfecting, just to protect your eyes and to ensure that you protect your skin also, especially based on where you are cleaning. You might need to wear disposable aprons. So these are the things we need to do and ensure that we do it the right way. So after you do all of that, you clean, you disinfect, and you sanitize. You know you need to wash your hands properly and store these things away from the children. Yeah? And by doing that, you can help break transmission within our schools. Now we need to do that because if we don't continue doing it, we used to do it for COVID, we need to get back into this practice. Or you realize an entire class has the flu, you need to do deep cleaning. Like I said, it is on both of our parts, parents as well as teachers at the schools and as well as our persons cleaning. We need to ensure that we do our part as it relates to the flu, because this thing is getting serious and more we're seeing more persons coming to our centers with the flu. We need to exhibit that level of precautionary measures at home also, especially when it comes to our elderly people, our persons with certain conditions, health conditions. We need to take necessary precautionary measures because we do not want to put them at risk. Again, if you're exhibiting any of these signs and symptoms and you feel you need to seek medical attention, feel free to come into our wellness centers or Soufre Hospital for medical attention. So having said that, I'm going to stray away from the flu and I forgot to mention hand washing. I did mention it, but we need to continue practicing hand washing. Proper hand hygiene with soap and water, soap and clean water. So many persons don't do it. I mean, they don't take their time to wash their hands for 20 seconds anymore. So you need to take time to do such. Okay? So all our children, all our schools, you need to have your liquid soap by the hand washing sink. And parents, you need to teach your children how to use the hand washing soap sparingly. Yes, and not waste. So this is one of the things I feel that we need to do. Before I forget, I just want to make an announcement for the Magouche area. The Magouche area, we're going to have a cancer screening for cervical cancer. Well, we're going to offer free pap smears on the 15th of February. I didn't want to forget. So free cervical and breast cancer screening, date 15th of February from 9 a.m. to 2 p.m. at Magouche Wellness Center. Okay, so for more information, you call 485-8657. So for persons in the Magouche area, especially persons that work in the Castries Basin, they are out for the entire week. Now is the ideal time. Nurse has taken this initiative to come in to do your breast examination as well as your pap smear. And it's on a Sunday. And it happens to be the Sunday after Valentine's Day, the February 14th. So if you know you're going to do your pap smear, don't want to wreck yourself. And next day you know it's a pap smear you're going to do. So program yourself for the Sunday that you're coming in to do a pap smear. Okay? You know what I mean. So speak to your partner on the 15th that you'll be going and do a pap smear. So you'll do the Valentine's Day after the 15th. So cancer screening, free cervical and breast cancer screening, Magouche Wellness Center on the 15th of February. So I think that's a Sunday. And for more information, you call 485-8657. So for Magouche and environs, you are invited. Come in and take advantage of the screening. Yeah. So I really want persons to come in and do that, especially in our Magouche area. Last year, we had quite a bit of people coming to do their pap smear. I think based on the statistics, it was a little less than 100 or is it a little over 100, which were very good numbers. Let me say this, that was very, very good numbers. So I was really, really proud knowing that the community is a very, very small community. So I'm hoping that persons around the area can come in and do their pap smear if they had not done it last year, or if it was recommended that they do it this year again. And some persons have not been doing their pap smear maybe from the time they had their last child or many years ago. So this is the ideal opportunity to come in to do your pap smear, especially persons from the Magouche and environs. Yeah, so I didn't want to miss out on that that announcement for you. So having said that, I want to speak about a little something that I feel that needs a little bit of attention. One of the things that persons need to understand is when you come in and you come to seek medical attention, you need to exercise and exhibit quite a bit of patience. And people need to understand if you come in for medication or any service that, for that matter of fact, everybody needs time with the doctors, they need time with the pharmacist, they need time with the nurse because they came to seek medical attention. If you have to work at 2 o'clock, don't come to the hospital at 1 o'clock or don't come to the wellness center at 1 and expect to get out within the 30 minutes. There are persons that are there from morning. There are persons that are there before you. There are persons that make time for their health. You need to do the same. Case in point, you are working in town. Your medication is finished. You have a chronic condition. You need to take your medication every day. You come in at 7:45 and you're working for 9. There are more than 10 people before you. Do you expect to get the medication for you to get to work? Or should you have left your home and reached there for it? And there is a high possibility you might have gotten your medication for that 9 o'clock before you get to work. So effort and time is important. If you do not want to take responsibility for your health, nobody will. There is so much others can do. So think about it. You have not taken your pressure or your diabetic medication from since last night. So you go and work for another 8 hours. Anything can happen. But you'll be quick to say, I came for my medication and they didn't give it to me. But you will not see the circumstances surrounding the issue. I'm just giving a typical example. You need to make time for your medication. You need to make time to see the doctor. You need to have a plan. Your medication is a 1 month supply. You know, the week before, you need to make plans to get additional medication. Or you know you have to do a doctor's visit in a month's time, then set a plan. What day, the week before, should I go and see the doctor? Let me make an appointment early. Let me find out what is happening. They don't put reminders on their phones. They don't do anything of that sort. But when they come in, like they wake up and they remember they had that to do, and they come in full blast, expecting to get service right away. And this is unfair to our elderly people that make time to come. It is unfair to our people with other disabilities that try to come. It is unfair to persons that live very far, where the transport system, the public transport system, it's not, ideal, but they make time to be there within a specific time. And we need to understand that, and we need to start breaking that cycle. It's not always about you, but other persons need the same service and they're making the effort. So you then now have to make the effort yourself. And that's what people need to understand. And they fail to understand that. And that's where the behavior starts. I am sorry, ma'am, the nurses are currently having lunch. You'll have to wait for another half an hour. I am sorry, sir. Can you sit down for at least 15 minutes? They will be coming to you. They currently have another patient whom they are dealing with. And that is an issue, you know. Because I walk in and I'm supposed to go in right away. It does not work like that. We need to change that behavior. And we're passing that behavior on to the younger generation. They're coming in and they're doing the exact same thing. Yeah? So these are the things we need to take into consideration. And these are the things we need to teach our children. When you come to the health centers, the wellness centers, and the hospital, carry your water or something to eat because you do not know how long you're going to be there. And I keep on saying that because I keep on seeing people staying there after the lunch hour, especially if you have to seek medical attention, wait for pharmacy, or sometimes they send you and do x-ray, so you have to go back in and see the doctor. So it's a process. Carry something with you, your water, a light snack, to help out the situation. So, having said that, I want persons to take all of these into consideration when they come to the wellness center, and to respect the nurses, the doctors, the pharmacists, the security guards, the attendants. You need that. And one of the things that you see happening is bullying, lack of respect. We need to stop that. We need to stop it. Because some of us we are adults, we bring our children for medical assistance, and we behave so badly in front of our children. And then we really need to stop that. What examples are we setting for our children? We need to lead by example. So when you come in, there are times you will not get the best service. There are times you will be upset. There are times you'll see somebody cut across you. These things happen. But how you deal with the situation is the most important thing. People need to understand these things in order to make things work smoothly at our wellness centers, at our hospitals. I understand you're sick. I understand you're in pain. But if you see me passing and I'm smiling, maybe you're in physical pain, but who is to say I'm not in emotional pain or mentally I'm unwell that day? So these are the things you have to take into consideration. It's not about you. Everybody has their own issues. So you see the nurse passing and she's laughing because somebody said something. That doesn't mean the nurse is not going back to her station to do what she needs to do. That doesn't mean that nurse cannot take a 15 minutes break to grab something to eat. After 2, she has not eaten. She needs to eat something. We need to understand these things, and these are the things that are happening. So I am asking the public to bear some patience. If you have concerns or if you have any queries, there are supervisors there. There is the Ministry of Health where you can go to and lodge your complaints. There is an avenue where you can do that. So take time. Take time when you come into our wellness centers so that they can provide you with a better service. Having said that, I would like to say thank you to all our listeners out there. And I hope you'll have a good week. And I trust that everybody had a good weekend. And to our drivers out there, let me say, please take all necessary precautionary measures out on the road. You're not driving for yourself. And for the pedestrians, I am saying to you, use the sidewalk. Please. I am a driver too, and I can tell you, use the sidewalk. Take time to cross the road. But when you're crossing the road, don't be on your phone and you're crossing the road. That happened to me just recently. And whilst the person is doing that, another vehicle overtake me. So if the person was still on that vehicle side, that would be a disaster. You're starting to cross the road and then you're looking at your phone whilst crossing the road. My goodness, you could just imagine what was going through my mind. So pedestrians, you need to play your part also, as well as our drivers. So I'm wishing everybody, again, wonderful week, wonderful weekend. Don't forget to come in to our centers for your services at all our wellness centers, Sufre Hospital. And if you have any questions, queries, feel free to speak to our health aides, our nurses. They will be happy to assist you. Again, Men's Health Clinic, Sufre Hospital, first and third Wednesday, as well as Lafag Wellness Center every second Saturday of the month. And I was at Lafag, and I can tell you the clinic was a nice clinic. Cool, calm, easy. Healthy discussions. Yes? So come into our men's health clinic, and I'm hoping that we can have good discussion with our male figures in our community. And the other thing is, I would like to see more men at our dental clinic. Come in and clean your teeth, our men. Come in, we want to see more males coming in. Young men, smokers, come in to start cleaning your teeth. Bring a partner along. Come and make an appointment every Friday, anytime after 1:30. So at Sufra Hospital for our dental clinic, anytime on a Friday after 1:30, come in to make your dental appointment for your cleaning. They do not do filling for adults. So they will do the cleaning and they'll do the fillings for children and adults. But for the cleaning for adults, you can come in, especially our male figures. All right? So again, thank you so very much for having me here. Again, Erlan, thank you for being there with me, although you disappeared. And he reappeared. But it's nice having him here. And again, Sufra FM, thank you for having us on this program. This program, I can tell you, is it's a program that is small strides, but very, very effective when it comes to the information out there and the public utilizing the information. Again, thank you to all our listeners. Do have a wonderful day and take care.